This is Richard Samalka. Today, I want to talk to you on the subject broadly that could be considered being cautious following healthcare advice from people whose credentials are uncertain or perhaps dubious. I think one of the things that perhaps I'm not unique in this is that I get a number of healthcare emails all the time from all different sources, but many of them lead you into having to listen to a 30-minute presentation where they take you through their journey in life in healthcare, where they end up either with more youthful skin or lower weight or so on, but you have to listen to the whole 30 minutes, and then they sell you something and it's a discount if you buy enough of it. And then other centers sort of lure you in like into a room with shadowy characters to hear what they have to say about the one supplement that you should eat to feel somehow better to yourself, or the one thing you should eat or not eat to be able to sleep at night, but they just simply don't tell you. You have to get lured into listening to a presentation, which I don't like. It's you sort of in the end sort of think, well, there's something somewhat scammy about it. So I would call this presentation then caveat emptor, which in Latin caveat means beware and emptor is buyer. But I think I want to extend it to caveat emptor consumptor, which is beware people who are consuming stuff. So it really brought about me and I've been thinking about this now for a couple of months, that some of the healthcare people that I work with, or even patients that I see with gadolinium toxicity, tell me about that there are people who are promoting methylene blue, something that you drink to, I don't know if it's to improve mitochondrial function or to eliminate parasites in your system. But it occurred to me, it gets back to what I've been saying now for a few years, that if you take something, there really has to be three properties if you're going to take it and buy it and take it. And number one is that there should be reasonable science in some sort of peer-reviewed literature that it should have some positive effect. Number two, I think it should be cost-effective as well. And number three, and this is a critical thing that I'm talking about, in this presentation, is that it's very unlikely to cause harm. So taking methylene blue is something that makes me very nervous. I would not do it myself, and I have not listened to these presentations, and I don't know what the credentials are, people recommending it. But what I have done is checked with other physicians who are very knowledgeable in healthcare in general and asked them what they think about it. And they've all uniformly said it probably is a little bit dangerous at best. So again, taking something that's likely to have a chance of being harmful and not really peer-reviewed, randomly controlled trials showing that it has benefits is something I strongly recommend you not do. Now, there are other people who I guess you could call them healthcare gurus, recommending things that are probably harmless enough, but do they on their own cause benefit? And I guess I've been interested in making this presentation today because yesterday I started watching a new series, mini-series on Netflix that I think I guess its origin is Australia, and about based on a true story. And I think the series is called Cider Apple Vinegar. Now, I've only started to watch this series, and actually, as I listening to it, the recommendations by the attractive young woman actually are so far are valid insofar as talking about eating a healthy diet. Now, a healthy diet is sort of something that should be what we all strive for. But to assume that it will cure everything, including cancers, is really untenable and not really established in any legitimate research. I think it is important to add these things in, and these are very critical, particularly for things that are not cancer related as such, directly cancer related as such, but on general wellness, general physical health. And they're the digestive system and the food you eat, for me, is one of the most important things. The next category, of course, is supplements. Now, supplements, to be frank, I'm just not sure how much many of these supplements help. So I never recommend anybody taking a huge list of supplements, particularly since they can be very expensive. So these are supplements that are probably founded on something that seems reasonable, like glutathione, for example, as a native in your body immune system protector and anti-inflammatory in general. But is it something that your body wants to process itself as opposed to receive from the outside? So for me, it's sort of like you want to learn to speak Spanish, for example, and somebody hands you a Greek English translation dictionary. And you think, well, yes, this is a translation dictionary, but it's not what I wanted. I wanted to learn to speak Spanish. So I generally am very cautious of most supplements. I think the most important thing is to eat a broad-based healthy diet, generically in the category of what you would call Mediterranean diet. Some exercise is good. Again, probably for most people, not a lot of exercise. I think excess exercise probably ends up being harmful for most people. But a mild to moderate amount of exercise, healthy diet, is probably the starting point for all of us in our healthcare approach. And then you have to pay attention to legitimate sources. So I have to admit, I'm very nervous about taking meth. I would never take methylene blue myself. I would never recommend anybody take it. Another subject, there's someone who's a healthcare guru talking of meditation, that meditation cures everything. And that's something along the lines, I guess, of Christian Science. Well, there's no doubt that reducing your stress is very helpful for basically everything. So if meditation is something that you use to reduce your stress, I think that's a very good idea. But to consider it that it will be something to cure cancer is ill-founded. So I think a lot of these things are like, the gurus that you read about, or unfortunately some people may have been adherents to. And I think most of these people are looking for power, money, and probably sex. So the final note, caveat emptor consumptor. Be very careful of what you listen to and what you follow. And as I said earlier, I use at least three independent sources that are legitimate, should show something is actually valid before I consider using them. Thank you for your attention.